When I was 31 years old, I just had my second child. She was 4 months old. I was blessed to be diagnosed with mono, which I was kind of surprised about because I was so old. I thought that I could only get it when I was a teenager, and I also thought for sure that I had been exposed. Not that I was kissing a whole bunch of boys in high school. Anyways, today we're going to be talking about infectious mononucleosis by me, Lauren Gifford. When a patient comes into a clinic, there are certain signs and symptoms that they can present with. They can have swollen lymph nodes in the armpits and in their neck, a sore throat, white patches on your tonsils and back of your throat. Sometimes this can lead to a misdiagnosis of strep, a stiff neck, fever, body aches, fatigue, and a swollen, tender spleen. As a side note, this mononucleosis can be asymptomatic in really young children or the very old. That's why it usually presents itself in teens as well as younger adults. That's why, because I was 31, that's why I was kind of surprised that I was even showing signs and symptoms. So what causes mono? That would be the Epstein-Barr virus. This virus is a formation of the herpes virus. It's a human herpes virus 4. It enters your body mostly through saliva or other bodily fluids. That's why they call it the kissing disease. It's very common and can present itself all over the world. It can also be a lifelong infection, so it might be dormant in your body for a while and then represent itself. I found this really cool picture from the American Society for Microbiology in their clinical microbiology review. I thought that it was a good representation of how this enveloped virus enters through the epithelial cells, attacks, it promotes those T cells, but also goes into that latent area, okay? And that's why that virus can stay in your blood and you can be tested and be exposed to mono and not even know it because it's in the latent resting phase, but it can reactivate itself and it can go back through your epithelial cells, can infect even if you don't have symptoms, it can infect your partner if you're kissing, or your child if you're giving them kisses. So in review, epidemiologically, it's transmitted through bodily fluids. It can remain latent in the body, but the most interesting part of my research came again from the American Society for Microbiology, and you can follow the link in my sources page. And it was a researcher named Hogland, and he was able to figure out that the symptoms will present themselves 32 to 49 days within oral introduction. So kissing or any sort of spit exchange. He did this through the means of basically interviewing patients and asking them questions and figuring out that if they kissed somebody 32 to 49 days earlier, that's when they got the infection. Diagnosis of a patient with mono. It begins with clinical observation. That's where the doctor sits in with you, listens to your signs and symptoms, looks in your throat, ears, may do other exams like a rapid strep test to rule that out. But for sure diagnosis in clinic, you need to do a clinical blood test. Pictured here is what that blood test looks like. It's a significant prick of the patient's finger, and the blood is placed on that screening plate. And what it's testing for is the heterophil antibodies. Those are the antibodies that your body starts to produce when they are attacked by this Epstein-Barr virus. That will give you a clear diagnosis. Due to the fact that Epstein-Barr is in fact a virus, there is no cure. So there's no antibiotic that can treat it. The only treatment that you can do for yourself is basically what you do for any viral infection. Rest, lots of fluids. You can use acetaminophen or ibuprofen, which is Advil and Tylenol. Make sure you do those correctly. Talk to your doctor. And those can help control swelling and pain. So can this virus be prevented? Well, to some extent. Of course, prevention always goes with hand washing, just good hygiene in general, and of course, no kissing, especially you teenagers. no kissing in the hallways. As a former teacher, we don't want to see that. I wanted to thank you for taking the time to look at my presentation and for letting me be in your course. I have learned so much and enjoy microbiology more than I ever thought that I would. I find myself asking the providers that I work with in my clinic so many more questions. They share slides with me so that I can see things that people come in with. It's just, this course has been a great blessing, and again, thank you so much.